Even early results are starting to show some quite clear differences between the three groups that we looked at. We had a look at elite athletes with type 1 diabetes, athletes with type 1 diabetes, and people without diabetes at all. And of course, I call these guys athletes because they have cycled 2,100 kilometers, so they are pretty good in any means. So the data shows clear differences between the two patient groups. So the elite patient group are spending less time with very high blood sugar levels, so hyperglycemia. They're spending more time in normoglycemia, or the area that they should be, normal glucose levels, which is important for two reasons. The first is around athletic performance, because the better the glycemic control, the better the fuel supply to the muscles and the heart during exercise. The hyper and the high levels are quite important because the higher the levels are, the harder it is to exercise, but also it has bigger or higher levels of damage to the microvasculature inside of the body. Now, not surprisingly, people without diabetes spend most of their time in normoglycemia. And what we've been able to do on the tour is see how people have started to learn over time. And it was quite clear that what patient athletes did on day 1 was very different to what they did on day 10. And that learning and narrative has been really important to the inherent learning of the tour. Being part of a large team from different areas, from the likes of Orange through to the GSMA, with Sony, with mHealth, has been really interesting because each of the partners brings unique skills. But trying to get those people working together around a clinical question has been really insightful. And what I learned was that these guys are absolutely stellar in what they do. But what we needed to do was give them a really clear clinical question to answer. So my biggest learning has been the way to communicate with different groups and the knowledge that no one group can do this on their own, that we do need to work together. The biggest learning from the tour I don't think is in data at all. I think it's in two areas. The first was how the data and the knowledge empowered patients to talk with other patients, to talk with clinical care teams, but also to connect them with new ways to think about their diabetes. The other area that I think we had enormous learnings were between the different technical partners. And as I mentioned before, that knowledge that no one partner can do this on their own, that if we are going to adequately address some of the key questions for people with diabetes, we need to work together. And that was one of the most fantastic things, because we started off in very different points, but by the end we're all working together to answer a very simple clinical question. But the future is very bright, and I think that that knowledge leaves us in a very good position to move forward.